We're going to do a tape job for a very acute ankle sprain. So this would be applicable if your dancer sprains their ankle in the studio and needs to go home with some comfort. If you have the knowledge and taping supplies, this is a really nice thing that you can do for somebody with an acute ankle sprain that just needs a little support to get home if they're taking the bus or, you know, whatever they have to do. It's a nice technique to know. So pre-spray is not super necessary because they're not going to keep this on for a long time and they're not going to play in it. I still use a heel and lace pad with a little bit of skin lube. In an acute ankle sprain, they're going to get swelling. All of these pockets are going to fill with fluid. So part of this taping is to help reduce that fluid. You could even take some of these foamies and fill in the pockets where fluid will fall. So if you have extra foamies, that's a nice thing to do, is just fold them and kind of fill in the divots. All right, your pro wrap or pre-wrap, this is still a lovely option coming off the back side of the roll to hold everything in place. It's a nice comfy compression that you can use quite far up, so everything has a little squeeze to it. This will help with your swelling. All right, and then we're going to use our white athletic tape and we're going to build a little bit of compression. Sorry, I'll give Rihanna a bit of a rest so she doesn't have to eternally hold her foot in dorsiflexion. All right, this tape does have to stick to tape. So we're going to put tape at the top. I'm going to do that one again because I don't like it. So if you ever put your tape on and you decide you don't like where it is, just take it off. I want to be a little lower on, sorry, Rihanna's calf. So I'm going to anchor this, but I'm going to leave a little gap. The tape isn't going to go end to end. I'm going to leave a little window or little channel because as she swells, if she swells a lot, I don't want to guillotine her foot, right? I don't want her circulation to stop in her foot because you wouldn't like me very much. If your dancer is somebody who wears toe jewelry and they have an acute sprain, take the toe jewelry off because you don't want it to get really tight around a toe. Okay. All right, so we're going to do our 3 little strips at the top, not closing them in the center, so they're not actually overlapping. I'm going to come into the foot because that swelling is going to go right in the foot. Over the 5th styloid, give her a splay and tear the tape so that it does not overlap. Pressing the tape down as you go makes it smoother. This is not for dance. Don't ever do this for dance, but for compression, it is really quite lovely to have a little bit of support, and they will feel so nice going home on the bus with a little more support. All right, so now I'm going to fill in the gaps here. So building a whole little sock around the back of the leg and the bottom of the foot. And I should end up with this nice little channel all the way down the front aspect of Rihanna's foot. Okay, so you're looking for nice even compression. And then I'm going to do a stirrup, and I'm going to do it like I did it for a eversion ankle sprain, where I come on the bottom of the foot first and make sure that I have nice even pull on the outside and the inside, coming straight up over those malleoli and pushing distal to proximal, helping any swelling move up the leg. I'm going to build her a little fan here, coming to the back side of that lateral tape and front side of the medial tape. One more. Whoop, keep that foot up. Sorry, I'm not holding it for you, am I? Okay, front side of the lateral tape and back side of the medial tape. So I have a nice comfy sleeve moving up your foot with space for swelling. Now that swelling is going to come all the way down her foot, so we're going to use a stretchy tape. I really like a light plast for this. This is very, very light and very stretchy. I'm going to come down by your toes. You never want to finish tape on the bottom of the foot because it'll just roll. All right, so step on it. You're going to pull it over. Do not pull all the stretch out of this, or Rihanna's little toesies are going to turn blue. But if you take about 50% of the stretch out of this tape, you can roll it nicely and create a cover sleeve. I still like coming underneath, giving her a little bit of figure eight action there. And I'm really just filling in. You could use a tensor bandage, but this is so convenient to use a cover tape. Little 50% stretch. And finish it off. So you should feel a little bit supported, nice and snug, but we know that there's space for swelling. We know that she still has circulation in her toes. So this is a lovely thing for an acute ankle sprain.